Hello.
Oh, sorry. I was kicked out by the system somehow.
Yeah,
I
same
don't know
here.
why.
I don't know.
Uh,
Somebody cut off the.
yeah, I don't know why, but I think we're here again. I think so. I think we can continue.
But
No.
other people are there.
Let me check. We have 18 people already coming back, so now 19.
Okay,
So I think people are coming back. Yeah.
people are coming back. Okay, all
Yeah.
right.
Or would you like us to wait for like 1 or 2 minutes?
Yes, we can probably confirm.
Yeah. Yeah. Let's wait like another 1 minute or 2 minutes till some of the people are back.
Okay. Yeah.
And hopefully we don't kicked out. We don't get kicked out again.
Right. I hope so too.
Yeah. Yeah.
So this is a new normal that we have to work with.
Yes, yes, the new normal that we have to work with. Yes, and then yeah, there's always like some technical difficulties in these
Yeah,
kind of
that's true. I think
session. Yeah,
yes, it's teaching us to be more patient with each
yeah,
other.
yes. That's true. That's
Right.
true. That's true. I think we have 23 people already joining us. So I think if you would like to continue with your
Sure,
explanation,
sure. Thank you so much.
yeah.
Right. Okay. Okay, so we talk about what needs to be done about this problem that is arising. We have already have documented proof that mental, social, mental and psychological well-being is impacted. So what needs to be done? So WHO has given some very clear guidelines about what needs to be done. So some of them I cannot probably cover the scope of it, but some of them is like we must have aware programs to extend the awareness that mental health of people and psychosocial well-being is impacted. So I think most countries are doing this. Already there are task forces, there are community groups which have been set up to provide some kind of help. So we also need to create interventions or create these task forces. We need to protect the underserved and the vulnerable populations. So this is something very, very important, I think, that as psychologists and behavioral scientists that we should look for, that it's not just the people who have a that we can reach, but it's also the people who are beyond our reach that we should try to find a solution for or give support. Another thing is about mental health. Otto et al. Mentioned that mental and behavioral health interventions should be fully included in the public health response strategies. So it's not just the COVID that we are looking, or the physical distancing and mask and this and that, but also providing mental and behavioral health supports and interventions. In another, very interesting study, it's like a review of study by Mukhtar, and it's this person. These researchers have they have kind of reviewed many researchers, and they very clearly highlight that we need to cultivate coping and resilience among the at-risk population. So this thread of well-being and mental health is important for my research, and I took it further because I wanted to find out how we can really help somebody during this pandemic situation. So, another aspect that is coming out very clearly, and that is the focus of my research too, is that impact on the younger age group. So research has shown that the younger age groups, they have been additional stresses to whatever other people are experiencing. So they have a lot of future uncertainty, social isolation, and even financial challenges. And these are more acute in people who already have problems. For example, people coming from a lower socioeconomic status, or people having some other disabilities or other challenges that they are already been experiencing. So among the vulnerable group of youth experiences, there is very high stress, anxiety, and depression. Now, these are just like four researches that I'm sharing here today, just to give an impact. that in Malaysia, in China, Italy, Spain, India, there are different researches. And I'm sure there are more in Thailand and India and in Indonesia. But since I could only get information in English language, I was not able to get everything. But there's a lot of research which is going on. And everybody who's in this area is trying to contribute in a meaningful way. So what needs to be done, if we can just conclude briefly here, and then I will move on to sharing my researches, that we need to create some research-based evidence and take information at multi-levels. So what is happening at individuals, family, community levels, and so on. Then we need to apply research and develop interventions. We need to have, like, families, communities, societies must be integrated in building resilience. And the areas of focus for me, I think, is meaningful is well-being, coping, and resilience. And somehow, because we are from Asia, I think Asian cultures are very different from the Western cultures. So we should explore, our cultural resources or the cultural dimensions that help in building coping and resilience among the youth. So I just wanted to share, like, we have limited time, but I would love to share, some thoughts on the research that I'm doing. So I'm currently doing a research which takes into aspect that behavioral science perspectives on coping and well-being during the COVID-19 lockdown. So my research was focused at the experience of people during the lockdown. So this is explanatory, sequential, mixed method research design that we adopted for this research. So in the phase 1, I collected data, quantitative data from online surveys during the month of May. In the phase 2, we conducted qualitative research. We conducted online interviews, in-depth interviews with about 21 participants in June and early July. Now, the phase 3 is the applied path of our research, and we've already analyzed some data, and we are building up some interventions and online workshops to support people affected by the COVID-19 pandemic. So the population and context at that time in the phase 1 and the phase 2 of the research were people who were living under COVID-19 lockdown and restrictions. So in my at that time when I did the research, I was hoping the COVID-19 lockdowns and restrictions would kind of ease by the end of this year, but it doesn't look like so, because many countries are now again experiencing more lockdowns. So I would try to, develop and modify my intervention according to that. So in the quantitative research findings, I found, like, there's a significant effect of psychological capital, social support, and perceived stress on well-being. So if you see, this is based on a behavioral science perspective that I showed you in the beginning, that person factors and the environment factors have an impact on the outcome. So the person factors that we took into this research are the psychological capital, and social support and perceived stress are the environmental factors that we had taken into account. And the outcome was the well-being. So how did we measure well-being? We measured well-being in terms of life satisfaction, positive mental health, and psychological distress. So some positive aspect and the negative aspect. So very interesting, or it's shocking. It's interesting, but it's still shocking that the younger age groups had lower well-being. The 21 to 30 years old were having significantly higher psychological distress as compared to the other group. And they had significantly lower positive mental health as compared to the older groups as well. So in terms of the qualitative research findings, so after we found out this result, we were trying to understand. We made like a structural equation modeling to find out which factors were important, and how we could understand more about them in the qualitative researches. So we developed like a semi-structured interview outline, and then we conducted the interviews using online platform of Google Meet. So data was collected from the young people and also from the elderly. So overall, we have a data set of 21 participants, and the younger age group was 13 people from the 21 to 40-year-old. So some of the themes that emerge in this during this qualitative data analysis was that along with the perceived stressors of COVID-19, the younger age group found it difficult to adjust initially to studying online or work from home, and there was a lot of kind of uncertainty. So I think most of the countries in which the lockdowns happened, a lot of them were having like a final examinations March, April, May. So the students had to learn quickly and adapt quickly, plus the work from home. So there was suddenly like we just stayed home, so they had to experience and adjust to the social isolation. There was a lot of anxiety about the future. This is true because young children are looking forward to making a future. They were graduating, some of them were graduating that year, this year. Some of them were already looking for jobs, but they cannot find jobs. So there is a lot of anxiety about the future. So it can be financial well-being, it can be social well-being, and their overall well-being. So staying at home, they had to not just adjust to, some of them were just staying by themselves, but they also had to learn to kind of adjust in the spaces, because suddenly they were like locked down, and some of the families were experiencing difficulties in the resources state. For example, the use of computer or the use of internet. I think all of us know about these kind of difficulties. So interestingly, at the end, which is meaningful for us, was the coping practices that they used. So a lot of emotional coping was there, but a lot of adaptive coping was there. And something which is very interesting is that people uh, initially, after reacting to the lockdowns and then becoming aware of the problems, they went back to their previous experiences and they could kind of look into their individual resources to deal with these problems. So the adaptive coping came from that aspect. For example, the people who had a lot of anxiety, or they have previously had some mental health issue, they went back to their practices, for example, doing some physical exercise at home, or maybe doing some meditation, or doing some yoga, or listening to music, or doing some other kind of thing to help them deal with the anxiety or the pressure of the situation. And social support, but this time it was like online social support, so people were using some base kinds of online social support to deal with the situation. So though I would like to just share, keep on going, I think it's time for us to move on, and I would like to come towards the end of my presentation. So what was the outcome that I would like to focus, or I would like to share with you? So at the base of this research, I think we have to have definitely individual focus. So each person is different. Psychology tells us that, and during this research also, it was very clear that each person needed some kind of different intervention to help them deal with the coping or enhancing their well-being. So this can be some kind of action research programs or sharing their best practices. And people with we need to focus on those with previous mental health issues especially, but we also need to build on community-based programs. So building resource networks to support them, or building a network of shared practices and use of social media. So social media can be used in a very positive way to deal with it. Another important aspect that I would like to highlight is the psychology-based intervention. So for us psychologists or behavioral scientists, we can actually integrate positive psychology, or maybe a CBT or adaptive coping, and our theory about different resilience, etc., into the interventions that we build in. So what are the implications of this, my research or the previous researches that are being happening at this time? I think what we need to just kind of, maybe sum up is that well-being has different perspectives. So well-being must be looked at from behavioral science perspectives. We must look at the different dimensions of well-being. So we cannot just focus on mental health, because a person who's having financial uncertainty, how much can you just help him if you just focus on the mental health? You can't really. So it has to be in tandem. So you have to make it integrated. We have to find out the role of other psychosocial factors, not, really the most important factors that can have a deeper impact. We need to focus on adaptive coping and building resilience in our individuals and youngsters, or the people who are vulnerable. So the well-being of youth, I would like to really encourage that we must understand the risk and the preventive factors. So we can build up the individual and the interpersonal resources into the resilience programs that we are developing. So what are the applications or implications? So this kind of information, I think, is important for researchers. It is important for practitioners as well, and the policymakers, as well as academic networks like what we have today. So I would like to end by, inviting shared experiences. So from the perspective of Indonesian experiences during COVID, how do you think we should deal with the long-term impact of the pandemic on the psychosocial well-being of the youth? Another thing that I would like you to please share your ideas is what are universities and higher education organizations doing? So what kind of online support is meaningful for students? Are we changing curriculum to really actually help support online learning? Can we create some apps? Are we doing some kind of online counseling support? So, what can we really do? So, that brings me to the end of my presentation today. I would like to extend thank you in all different languages. So, I would like to say Dhanyawad from India, Khopkun Ka from Thailand, and Terima kasih from Indonesia. Thank you so much.
Yeah. Thank you so much, Dr. Kanupriya Mohan, for your presentation. Very interesting line of work. We're open for a Q&A session right now, and we already have one first question. And the question was that, can I get the seminar material?
Okay, sure, we can.
Probably. I think we can manage that. Maybe you could send us the materials, and then we can distribute it to
Right.
the participant, of course.
Right.
I would like to inform again for all of the attendees. You could post your question via the chat, and then you can post your question either in Indonesia or also in English. If you're posting it in Indonesia, I will try my best to translate it to Dr. Mohan. If you're typing in English, then I think Dr. Mohan could also read it directly, which is much more convenient, of course. But feel free to write in Indonesia if you think that you can articulate your words much better in Indonesia. And I'll try my best to translate it to Dr. Mohan. So,
Mark, may I ask one question? May I know something about our participants? What kind of background these?
The participant, as far as I know, most of them are also psychologists. Some of them are psychologists. Some of them are students in psychology, master students, bachelor students, and I think there's some of them also are doing their PhD. Wow. I know a couple actually is doing. They're doing research relating to pandemics also.
Wonderful.
And then in the app, in the Zoom app, we can only see about 31 participants, but we also have a YouTube Live. So I think there's much more people in the YouTube Live, I think. So there's a question here from Johan Satria Putra. As far as you know, are there any publication or soon to be about community-based intervention of well-being to youth during pandemic?
Okay, just let me read this.
Yeah.
Okay. I think, for example, we are also doing a research apart from this thing. So we are talking about community-based interventions in Thailand, because I think Asian culture is very rich. I think all across the ASEAN region, we will find these community-based interventions. So I don't know about the published, because, I think probably the language can be one of the barriers, but there is research definitely going on in from the community-based intervention. Very good question.
So just to follow up Johan's question, do you happen to know like an already developed intervention program, like ones that already being implemented or practiced?
I'm not aware of it as such. Mm-hmm. You mean specifically in Thailand?
Mm-hmm.
Community. So actually, maybe I can just share probably with you that Thailand has a very good network of community health professionals. So the
Mhm.
network is very strong, and that's one of the reasons Thailand has been successful.
Mhm.
We actually have no community cases here in Thailand.
Okay.
So
Okay.
there is like a very strong network of these healthcare workers who go to the different community villages
Mhm.
in the far away provinces. So that is working. But in terms of intervention, I am not aware of that at this moment.
Mhm.
But I would love to look into it and get back to all of
Get
you.
back to it. Yeah.
Yes.
Yeah. You mentioned while we were waiting for people to probably type their question in, I'd like to ask you a question. You mentioned that people are also trying to get online support, right?
Yeah.
And I think I've heard that people starting to go on apps, on social media apps, not just Facebook but also other kind of apps. I mean, do you have any knowledge about the effectiveness of this kind of approach?
Yeah, I think in terms, I know that this kind of apps or this kind of provision is there
Hmm.
both in India and in Thailand, but I do not know about the efficacy of or the
Hmm.
effectiveness of giving this kind of support in long term. Now
Hmm.
it's very interesting that in Thailand,
Hmm.
when initially, I think in the month of May and June, they started talking about having this kind of mental health intervention online. But
Hmm.
since the lockdown has opened, there have not been any community cases. So people have kind of reverted back
Hmm.
to face.
Okay. Okay.
Yeah, so that's something which is different in Thailand. But
Hmm.
in India, I think it's still not there. So, and there is also the problem of, stigma
Hmm.
that people don't want to reach out
Hmm.
or they cannot reach out because of the stigma and the discrimination
Hmm.
because using apps also you need to be educated enough or you need to have that much of money
Yeah.
or resources. So
Yeah.
I'm not sure that it's actually deeply helping the people in
Yeah.
the really the vulnerable people.
Yeah. Yeah. Okay. Yeah. Yeah. That
So
makes
this is a
sense. Of
wonderful
course.
area of I think it should be a very wonderful, very good area of
Hmm.
research
Hmm.
that we could probably do across different countries.
Hmm. Yeah, because I was thinking that sometimes some online platform also they're paid
Yes.
and yeah they're paid and then sometimes there's some games in it and then and I was thinking that it'll probably make people become having a new addiction to online platform rather than cured by things like that.
Yeah, that is another perspective we need to take into
Yeah.
account.
Okay, here's another question from Subahan. I will try to translate this for you. Let me just read it real quick.
It's not posted in the chat that I can see.
Yeah, it's not in the chat. I think because someone sent it privately to me,
Yes.
so maybe misclick. um, okay. Okay, here's the question. The question is that why the youngsters are the ones more prone to stress during this pandemic. We know that the youngsters, especially millennials, they have the knowledge, technological knowledge. They know how to use technology, and they know how to use gadgets. But how come they're the ones being prone to stress?
Yeah, that's a very, I think that's like one of the very meaningful questions because if we don't understand, we can't help, right?
Hmm.
So I think it is because of they have never experienced this. Actually, none of us have experienced, even our generation, I'm quite old, but we have never experienced this kind of a situation. But I
Yeah.
guess, like, as we grow older, it's very interesting that research on well-being also shows that older people have higher levels of well-being. So
Hmm.
I think after a little while, you kind of get used to the ups and downs of
Of life.
psychologically or
Yeah.
in terms of research, it shows like that, right? So
Hmm.
I think for the youngsters or young people, it has been a big shock,
Hmm.
right?
Hmm.
And they have never experienced this kind of, impact. And I think the social isolation of being alone at home has had a
Hmm.
major impact. And it
Hmm.
that in many countries, when the lockdown opened, you see of behavior that people go out for parties. They even in the Western culture, they go out for pubs. We don't have that pub
Yeah.
culture in Asian
Yeah.
culture, but in the Western culture, we hear of people going out to pubs and parties and
Yeah.
some kind of interaction. So I think the social impact has been a lot on for the youngsters. But I think most important is the uncertainty of their future.
Yeah.
Because in India, if I just give you an example, I think all of you must have read, even in Indonesia, when the lockdown started and it was open for the first time, a big group of
Oops. What is that?
I don't know, somebody's microphone probably got unmuted. Looks
Yeah. Yeah.
yeah.
Yeah.
A
Maybe.
big group of immigrant laborers went back to their villages.
Mm-hmm.
So a lot of people have lost jobs, and
Mm-hmm.
each country is different. I think in Indonesia also you have the younger people in majority, right?
Mm-hmm. Mm-hmm.
So in India, the younger people are like 40 to 50% of the population.
Mm-hmm.
So when they are losing their jobs and going back, that has a very deep impact.
Yeah. True.
Yeah. So
Yeah.
that financial uncertainty or what they're going to do, when they're going to able to do, that is creating a lot of stress.
Yeah. Of course. Yeah.
That's
Makes
my
sense.
understanding of the situation. Yeah.
Because I think I read an unofficial, so not official data, just sharing from one researchers to another. Yeah, I think in Indonesia we also have the youngster age between 20 to 35, I think, who's also getting the worst impact of all.
I see.
Okay.
I would
Uh,
share this kind of research if it's published or something.
mhm.
Love to get to hear about that. Yeah.
Yeah. Yeah, I wasn't part. I was not part of the project. It's just from one researcher to another. But maybe I could send you an email if they publish it.
Yeah, sure,
I'll
sure.
let you know about it.
Absolutely.
So we have another question here from Dewi Kumala Sari. Yeah, it's in English, fortunately.
Yeah.
So I'm just going to read it out loud. Thank you for your interesting presentation. Many people choose to ignore health protocols by hanging out with friends because they think it makes them happy, and that feeling happy will increase their immunity. How do you think about this?
Yeah. Actually, I can understand the feeling happy part of it, but that's like it's a policy. I mean, it's like something which is, as we all know, I think what we should kind of encourage is that people should follow the medical science. That's
Mhm.
the most important learning for me, in this thing that people need to follow the medical science. But we are human beings, we are
Yeah,
diverse.
yeah,
In psychology, we know the probability curve, right?
yeah.
We have the people in the middle and people in the extreme. Yeah. But somehow the pandemic has kind of made like a clear divide in the people who believe and the people who don't believe. Unfortunately, that is
Mhm,
something that has been the impact of this pandemic in our understanding.
mhm,
So what do I think? I certainly don't agree with it that they should go out, but I do understand that from what do you say, from a youngster's point of view, that social isolation is playing out. It's still there. We have not ended it, so there is no like a end to this pandemic, and that
mhm,
is now becoming a lot of burden or a psychological pressure on them. So that's
mhm,
the reason they want to go out.
mhm.
I hope
Yeah.
I've answered your question. I'm not sure like it's correct or wrong.
Yeah. I think I can tell. I can also say to the participant. I mean, if you have a follow up question, you can also state it in the chat, and I'll try my best to moderate it also. Okay, here's another question from Rahel Monica. Oh no, it's not a question. This is just a link for a certificate. Sorry. Um, yeah. In relation to Dewi Kumalasari question. Uh, Maybe could you explain a little bit, probably in your experience, or maybe if you have your own family within your own circle, what do you do to prevent this to happen? It's like youngsters going out all by themselves, partying around. What's your tip on this?
Yeah, so it's very interesting. Uh, personally, if you talk about me, I have two sons. One is in Singapore, one is in London.
Okay.
Their experiences of the lockdown are very different.
Uh-huh.
And I think in Singapore, the lockdown or the rules are very, very clear. If you
Mm-hmm.
don't do, you get a fine. So
Mm-hmm.
Singapore is a small place, small country, and they have to follow all the things.
Mm-hmm.
And my son was pretty, he and his group of friends, they did not violate any kind of, restrictions.
Mm-hmm.
However, in UK,
Mm-hmm.
where my other son is, there was like a double message,
Mm-hmm.
so the messaging from the government needs to be very, very clear
Mm-hmm.
that you don't do this, and
Mm-hmm.
then people tend to follow, even the
Mm-hmm.
young people.
Mm-hmm.
So I think it's, though, as older people in the family, I'm like a researcher, so I always share the information, the facts that this should be done. So I've been very fortunate that all the young people in my family and my nephews and nieces, they were
Mm-hmm.
generally following the rules,
Mm-hmm.
even in India. But in India also, like now the unlockdown is there and people can go out. So in
Mm-hmm.
Thailand, I see something very fascinating.
Mm-hmm.
This is, I'm not sure, it's like it's very, very specific to Thailand, or maybe it is across Asian culture. There is a dimension of, collectivism,
Mm-hmm.
not individualism that we see in America, that, oh
Yeah.
no, I have to decide whatever I have to decide, and they
Yeah.
do that. But
Yeah.
in Thailand, there is like a collectivism. So
Mm-hmm.
the Thai society, all the young people are wearing a mask. Everybody
Mm-hmm.
is wearing a mask.
Mm-hmm.
And there is no community transmission. There are no cases right now. But
Mm-hmm.
everybody wears a mask because they are looking at the other person. So it's like a peer pressure or
Mm-hmm.
the community feeling,
Mm-hmm.
or maybe like a, it is a cultural factor that I can see that plays out here. So
Mm-hmm.
everybody is wearing a mask here. But
Mm-hmm.
now, because there are no cases, so that physical distancing is
Mm-hmm.
not practiced that much.
Mm-hmm.
People are roaming with a mask and trying to follow the rules and sanitizing, and if you
Mm-hmm.
go somewhere, they're checking your temperature, so people are able to follow the rules.
Mm-hmm.
This could be a cultural factor too. I would be very happy to know what happens in Indonesia, like
Mm-hmm.
what kind of impact is there. Some, but I would like to hear from some young people in the participants, if
Mm-hmm.
they have something that they can share with us.
Mm-hmm.
What do they do?
Uh, yeah. Yeah, we can wait for that if they have something to share. But here's a question from one of the YouTube viewer. Some our YouTube viewer posted a question. His name is Idam. I think this is Idam Shahputra, Dr. Idam Shahputra, uh, one of my colleagues also. The question is, there have been huge protests in Thailand as well as other places. How it gave an impact to the spread of the virus.
I see. Yeah, I think you would be hearing about the protest in Thailand. But as you would see, the protests are happening now. And initially, if you see the behavior of the students who are protesting or the people who are protesting, they were wearing a mask. There cannot be any physical distancing in the protest. Initially, there was, but I think most of them are wearing a mask. So, right now, since there is no community cases, there is no COVID actually in Thailand. So, I'm not sure. And we have not heard about any spread of any cases in the recent a few months also. So
Mhm,
I'm just hoping that it will not happen.
mhm,
But unfortunately, science does show that if when people get together, it does have an impact. We can see in America, they have
mhm,
gone out for voting, and now you can see how many cases. I think today they were reporting 160,000 cases just
mhm,
in one day. So when people get together, and if they're not following the protocols of physical distancing
mhm,
and mask wearing, it will have an impact, definitely.
mhm. What do you think about like for example, at the early stage of the pandemic, in the city where I'm living right now, we record basically zero cases
Wow.
because there's no testing, there's no
Oh,
system
right. Ex-
to assess the pandemic, the virus, so um, could it be like also in Thailand, in countries like in Thailand, where there's like my minimum cases that it's because the system isn't really as good as the system in probably in European countries or in the United States.
with the testing and the tracing and
Yeah,
everything. Right?
yeah.
I'm sorry, I mean, I would love to say, yeah, it's absolutely okay. I'm sorry, I'm not like a medical, practitioner. I don't have that much information to answer this question.
Yeah,
But I would love to say that no, it's absolutely good.
it's absolutely good.
Yeah,
Yeah.
it's like
Um,
this is this is the problem that may some of the countries will we don't know exactly the spread of
mhm,
the disease, yeah, because they're
mhm,
not testing enough.
mhm.
So I'm sorry, I cannot give that answer. Yeah.
Uh, yeah, yeah. So I'm just going to cue a little bit of the YouTube here. Hopefully, I can maybe I can see some. There's like some questions here. Um, Let me check. No, there's no questions. So hang on. In the chat. Yeah. So I was wondering about that. You mentioned um, that culture, our collectivism,
Yes.
um, the collective side of us, once we have a norms of wearing masks, then everybody start wearing masks. But at the same time, I was thinking that, okay, once people think that, oh, it's okay now, and then people start to, neglect all of the protocols. So it's like a double-edged sword.
It is.
What do you think about this?
Yeah, I think that is so everything. Like we know there's some positive and there is some negative consequences of anything that we experience as human beings, right? So it's important, like we take into account the impact of any factors which is playing out. That's what I was talking about, that even for the well-being we need to be aware of other psychosocial factors which can have a positive impact. But if there is too much of collectivism, so we don't kind of question what another person is telling us, and that can definitely have a negative impact,
Mhm,
right?
mhm,
It's true about individualism also, so it can
mhm,
help us to kind of go ahead and follow what we want to do, but it can have a negative impact, like I don't care what is happening to you from
mhm,
that point of view. So any factors, as human beings or as psychologists, actually we should be able to kind of evaluate their
mhm,
positive and the negative impacts.
mhm,
So I think for that, all kinds of research is important. We
mhm,
use quantitative research, but that gives us only information on the top, but that gives us bigger numbers. But
mhm,
we should go into qualitative research
mhm,
and use different methods of qualitative research to find out deeper meaning.
mhm,
So I think it would be very fascinating if we could kind of make like a network in which we could investigate across Indonesia and Thailand,
mhm.
that how the cultural factor has helped in maintaining well-being
Yeah,
of age groups. Yeah.
yeah. You mentioned that you did a qualitative research, right? A qualitative study
Yep.
already, right? With
Yeah.
21 participants, I think.
We had 21
Yeah.
participants.
So, could you tell us a little bit more about this? I mean, what did you find there?
Okay,
What?
sure. So
Mhm,
because when we started analyzing the quantitative data, we found that we thought like, okay, everybody would be having an impact on the well-being. But when we started analyzing the quantitative data, we found that interestingly that it's the younger people who have more psychological distress, less positive mental health, and more impact on their life satisfaction. So the point was now, what kind of sample or what kind of participants do we choose for the qualitative? So we decided to choose some more of different age groups, younger age groups. And then we contacted the participants. We had actually, when I done the survey, so we had given that option that if you would like to be included in the qualitative phase, or if
mhm.
you would like to be included in the applied phase, please give a tick mark. So we had a group of about 50 people who had
50.
said yes, yeah,
Mhm,
50. So then we started contacting them and we wanted to capture the information during the lockdown.
mhm,
So most of my data came from India,
mhm,
then from Thailand, and
mhm,
then we had countries. I have some countries like Malaysia, Singapore,
mhm,
Philippines, UK, and then there were some Indian people who were living in different countries. So we had like different data from different countries.
mhm,
So for them, I think then we started talking. We had like what do you say, like um, like a pilot. interview with a young person also based on our questionnaire, and then we develop the questionnaire item. So we developed the questionnaire item and we pilot tested them. Then we invited the people using Google Meet to come for the in-depth interview. So it was like an in-depth interview for 1 hour.
Right.
And we asked some series of questions. But of course, it's like semi-structured, so we allowed them to share their experiences. So some people had a lot of things to share. And interestingly, I don't know, I would like to explore this further, that people who had previous mental health issues, you
Okay.
know, like maybe depression or anxiety or any such problem, they were able to take a seat back and, come up with their own individual coping, adaptive coping strategies faster and quicker than the other group.
Oh, really?
Really, that's something so interesting, because probably they had experienced this kind of pressure or this kind of, stressors before.
So the ones that previously have been diagnosed with depression or anxiety
Yeah.
are actually coping better than the ones without such diagnosis.
So I'm not sure about the end result of coping, but they definitely were able to use those adaptive coping strategies.
Okay, that's
Faster.
very interesting.
Right.
Yeah,
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 that was something, it's like eye-opening. So,
yeah,
yeah. So there is, like you said, like a positive and a negative aspect.
yeah.
So,
Do you have an explanation regarding?
I'm sorry, I don't really have an explanation in terms of research about this, but I guess like a layperson, or what we have experienced in our previous researches, I think the way we cope, it's like a transactional system of coping that we use. There are some stresses. There always are some stresses in our life, right? But there are also some, like internal resources that we build up over a period of time.
Yeah.
So they were able to use those internal resources maybe better at this period of time than the other people who did not have these kind of stresses before.
Okay. Okay. So it's like they already have the baseline
They already-
of what to do and things that they need to do,
Right.
where to get help and so on, while most people don't have this experience at all. That makes sense.
Able to get help from outside. Let me just clarify that none of
Yeah.
them were able to get help. So there wasn't any
Okay.
online, and this sample that we have collected, these are already people or youngsters who have computers, who have internet, who can speak English, who are able to, understand. So they are already not, in terms of the social economic status, they are much better off than
Okay.
younger people who are living in maybe villages or provinces. Right?
Okay. Okay.
So we cannot, my research is not reaching out to those people. So
Yeah.
the sample that I represent from my research,
Yeah.
I have to be very specific.
Yeah. Of course. I mean, it'll be quite hard also, right? I mean, I can imagine at the time that you collected your data, it's hard to reach people with a low income status because you can't go out, you can't meet people, right?
I was in the lockdown there in the lockdown. So
Yeah. I can imagine. Okay, so here's a question from Khadija Zahira Haq. I'm just going to read it out to you. Good morning. My name is Khadija Zahira Haq. Thank you to Dr. Mohan for the presentation. Very interesting for me. I want to ask you about, do you found in your research how due to the lockdown? As we know, some young people really like to do social interaction with their friends or other for their co. The last one for parents working, but must be at home so that they see them directly, I think. What do you think, or do you have any idea for the best coping for them? Yeah, because the research I did while doing on my last paper found that workers make work as their stress coping to avoid stress. Oh, okay. So if I can just rephrase, she did a study that parents often use work as a coping mechanism, as a coping strategy, but now they can't go to work and they have to face their children. So what is the best coping strategy for everybody?
Yeah, very interesting. Actually, this was one of the bigger factors, and there is like a gender role expectation that also plays onto it. You know, for example, I think in the Asian culture we expect mothers to take care of children more than the fathers, and women tend to they were forced to do the housework as well. So no maids or no help could be coming at that time. Children are at home, so you need to do your work, you need to take care of the child, you need to do the housework as well. So there was more of a gender, role issue about this problem. But men also experienced problems because they were working from home, so they had to also kind of chip in. So this is something very interesting. So that was it was definitely creating a lot of stress for people who had young children at home, and they found it very difficult. In fact, it was like in one of our interviews, I was interviewing a person who's working as a head of psychology department, and she was also the director, or maybe a deputy director at a college. And her son started banging the door, knock, knock, knock. Mommy, mommy, he's like knocking at the door. And she's like, she had to open the door. And he came with a paper. I want some water. You know, he had a paper. So it's like very interesting that even in the
Yeah.
research, we kind of experienced it. So what kind of coping strategies they were using? They were actually trying to have, it was already like 2 months, 3 months. This is in the month of June that we took the interview. So they already had like, having some kind of boundaries set up, and having some other elderly person to take care of that young person, young child at home while they do this. So this is possible probably in Asia, but what about single parents? So that is one issue that really needs to be, it has been definitely stressful. So they
Mhm.
were managing time, so time management, setting up boundaries, getting some additional adult help. They were trying to do this kind of coping.
Mhm.
But a
Yeah.
very, very meaningful question.
Yeah. 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 It's a very good question
Yeah.
from Zahira. Yeah. Thank you, Zahira, for the question. That's a very, very good question. Um, I was thinking while you were answering this question, what was it again? Oh, now I forgot about it. uh, oh, let's just go to another question. I forgot about it.
Okay, okay, sure,
Uh,
sure. Or
let
maybe
me
if
see.
you remember later, you can ask later.
Yeah, maybe I can ask later. Sorry, let me just check whether the time, if we're okay on the time. Um, do I? 5 more minutes in. Okay, we have 5 more minutes actually. Um, so there's it's not a question.
It's not a
Uh,
question.
yeah, it's not a question. I have a question, but I forgot where I put that question because I have so many tabs open in my on my computer. Let
Actually,
me.
maybe can I ask a question and ask people to just type in a word, like
Okay.
young people?
Mm-hmm.
So I would like to know that, the younger generation in Indonesia are
Mm-hmm.
students, who are graduate students. How did you cope? And what, I don't want everything, but maybe just what was adaptive coping, in the sense, what was a positive coping strategy that you used? Maybe can you just quickly type some word?
Okay.
Maybe just, doing some cooking, doing something, or, something like that, if we could ask.
Yeah. Okay. Yeah. If you could help Hans question, what do you do as a coping approach during the pandemic? You can type in one thing, or you can type another word like swimming, or if you can, running, or something like that. Is that it, Dr.
Yes,
Mohan?
yes,
Yeah.
yes. I'm writing it down as well.
Yeah. Okay.
Love to hear from them. It's like it would make my interaction some meaningful. Usually, I usually don't like to give lectures. I
Uh-huh.
like to have a lot of interaction.
Yeah.
Yeah, so this is a lockdown effect. I have to look at blank screens.
Yeah. Yeah. Yeah.
Yeah.
Yeah. Yeah. Oh, yeah. I can imagine that. I have two kids at home, and during the pandemic, my wife also worked, and I also work. Yeah, it's really true. We had like super. It was super stressful in the beginning because the kids don't go to school, and up having to teach them ourselves at home. Yeah, and it was super stressful. But are there any research that you like really specifically targeting this kind of group of people? You know, people like me with little kids and how we cope with it.
Yeah. So, initially I really wanted to focus on when I started the research, I really wanted to focus on the gender differences.
Hmm.
And I was thinking, yeah, because already there were reports that women have to work more and all. But I think over a period of time, I realized that I think we have changed as maybe the younger generation, like you are there, you are looking after the childcare equally. So it
Hmm.
was like a common stress. So I don't have stress research-based evidence, but I know that a lot of organizations were providing online support
Hmm.
for both men and women, all kinds of employees, and
Hmm.
they found out that they needed to have a lot of online support
Hmm.
set up because men and women both experienced a lot of stress while they were staying at home. So having some kind of a channel like online counseling or online support systems where people can talk about their problems can be meaningful.
Hmm. Hmm.
But
Yeah.
I think we need to look up into this, that how did it really play out for work at home, and especially the younger people
Yeah.
having children.
Yeah. Yeah, I'm curious because I think I haven't seen any published work on that. I thought I might have read some.
So no, I didn't
Yeah,
specifically read about the work at home because the
yeah.
work at home experience is very, very, it should be something very meaningful to explore as well.
Hmm. Hmm. Okay, I think people are very shy just to type one or two words.
Can they type in?
Here's one: seeing YouTube.
Oh, okay, that's cool. On
Ah,
Netflix, do you see
yeah.
Netflix there?
There's one.
Or learn some new hobby, pray and watch my favorite movie. Yeah.
Maybe there's something at the YouTube. No, there's none. Yeah, people are quite shy here in answering stuff. Well, I myself, I used to run, but the pandemic got me stopped running. And because I don't know whether this is my own impression, but I do have the feelings that the pandemic makes work much more.
Yeah.
Do you feel that? I mean, I feel like I have to work more than previous and previously when there's no
Absolutely.
pandemic.
Absolutely. So this is one of the themes that has come out in our research also, that the young people who are working, they said that there is no work-life boundary now because you're
Hmm.
sitting in front of your computer all the time at home, so that the travel or that break that comes through, that is not there. So they said that this is their work-life boundaries. They kind of they're melted. They have
Yeah,
gone away. Yeah.
yeah.
Personally, for me too, I think I have never worked like this before.
Hmm.
I continue to work. I also like to have some exercise, but because we are staying inside, I really had to work hard to make a break. That this is my work life is over and now this is my personal life. So that kind of difficulty so I think this was one of the adaptive coping strategies. So when they reported about the stress, they mentioned that they did not have work life boundaries, but in adaptive coping they started having setting up some routine to the day,
Okay.
setting routine and
Yeah,
time management both.
yeah,
They would start at the same time, like for example 8 to 5 they work, then they
yeah,
take a break, or maybe some of them said in the lunch break they would do some exercise or dancing or
yeah,
coffee calls with friends or
yeah,
something like that,
yeah,
and so that they have that kind of a balance in their lives.
yeah, yeah, that feeling of not working.
We got another answer. I usually pray and watch my favorite movie. Okay.
Ah,
My long left out painting. So yeah, doing something creative, doing something that you have not done before.
yeah, painting. A painting sounds good.
Yeah.
Yeah, pray and watch my favorite movies. Yeah, okay. Dr. Mohan, it has been a very interesting talk with you. I really enjoyed the talk, our conversation and discussion. But I think our time is 3 minutes out, I think. So yeah. Oh, hang on. Can we just like read some more of these comments before we
Sure,
end
sure,
this?
sure,
Yeah.
sure.
So yeah, here's this. Interesting, Dr. Kanopia Mohan. Thank you. I would like to ask about young adults in Thailand. Are they quietly stay at home as commanded by the government? Because young adults here in Indonesia, especially in North Sumatra, young older adults tend to break the rules and going outside home without wearing mask. How about in Thailand?
So yeah, I know in Thailand they generally stayed at home. Definitely,
Okay.
most of them. Like I told you, like it's amazing. I was like so amazed, that because I'm coming from India and I see a totally different culture. So out here, mostly the young people they were staying at home. There were just a few people who were going around, like maybe they go on the bikes or they go out at night after the curfew. So the curfew was imposed initially at night time. And there were just a few youngsters who were breaking it, but they were like fined heavily. So I think that information was widely shared and then it got scared. But mostly I think the young people stayed at home.
Ah,
So that's very interesting. Yeah. And going out with the mask. They are always wearing a mask. Well, now you'll find everybody in the university wearing a mask.
wearing a mask. Oh, that's actually very good.
Yeah, very good indeed.
Yeah.
Like you say, we don't have the cases here, no community transmission, but cases that are being reported are only people who are coming back, repatriation flight. But they're still wearing a mask. So that means, I mean, whatever, it can be interpreted, but it's pretty good behavior to manage the COVID. Yeah.
A very good behavior, I think, compared to what's going on at certain places, like one of them here where I'm living right now. Yeah, and then there's also Khadija. She said that during lockdown, she learned to cook, and she got interested. That's interesting also.
I'm sorry, I couldn't hear the last part. She learned to cook and?
She learns to cook and also conduct research.
Wow. Okay. So
yeah, so that's interesting.
That is interesting.
Because for me, research is job. It's a job. It's a stress source.
Yeah. But I'm telling you, I did this research and I was really very happy because I just tell you another aspect of doing the qualitative research. One of the participants who had actually some previous mental health problems and another person, she was working from home. Both of them did mention that when they were able to talk out about their stress, it was kind of like a therapy for them. They felt much better after talking. So, sometimes if we give people opportunity to listen and talk, somebody else to listen to them, their problems, it does help. Right?
It does help. Yeah, it is really true.
I would love to help. May I just share that, I would love to help any students who would be interested in joining my research. I'm building up some intervention and I would be implementing this interventions in December. So in case your students are free during that time and they would like to do my research, join my research, I would love to welcome them and, they can join the online intervention free of charge, no problem, nothing, no money.
That's super nice. I mean, I think some of our students at our university are doing some work relating to the COVID pandemic, to the pandemic. Yeah, I think I could pass this also to them. And I don't know, maybe also we probably think about some joint research between our university. Absolutely. Right? Yeah. So, but our times is up right now. Thank you very much, Dr. Mohan, for your talk and also for the conversation that we have and also for answering all of the questions that were posted here. I wish you good luck to your research and I'm looking forward to reading your work again in the future.
Sure, I hope so too. I would be very, very happy to share my research results. I plan to write some research papers and publish them soon. But unfortunately, the teaching work is going on, so it's going this delayed. And I look forward to hearing from you people. I think you're doing a very, very meaningful job, and I congratulate all of you to organize this online conference. And I wish you all the best. So I look forward to hearing more about what you are doing later on. Thank you so much.
Thank you so much. Yeah. So how do we end this? Should I just end it or I have no idea. I think I'm going to wait for you to, you can leave the room right now, I think. So I'm going to wait for that.
Thank you, Dr. Omar. So I hope that we will contact later on. Thank you.
Definitely.
Thank you. And
Thank you.
all the best to all the students who are present here today.
Thank you. So,
Doesn't work.
doesn't work?
Yeah, I think they have to kick us out.
No, really? No.
Like that.
Oh, really? Okay, let me just ask. How do you end this? Just, can you help me out here, please? Oh, I have to leave
You have to-
button. There's the leave button, I think. We just have to leave the button. Okay. You see it?
Yeah, I can see it, right. Okay.
Yeah, okay. Just press that.
Thank you.
Thank
And
you. Bye-bye.
I can share okay, I will write to you.
Yeah, the materials, of course. I think I'm gonna write you an email so that I can share it out. Yeah.
Sure. Okay, thank you so much.
Thank you so much.